Hi, it's Ron Ruffner from RWR Dental. We're really excited to have Dr. Gary Glassman with us today. Gary, tell us a little bit about yourself.
Thanks, Ron. It's great seeing you. My name is Dr. Gary Glassman. I'm a full-time practicing endodontist. I am Chief Dental Officer for Dental Corp and Faculty Chair for DC Institute, our teaching division of Dental Corp. And I've been practicing endodontics for almost 40 years and teaching it for just as long. I teach dentists the latest and greatest in technique and technology so they can provide their patients with the best possible care. And I found that teaching probably one of the most rewarding experiences in my career.
Awesome, Gary. Now, we met up a few years ago, and you helped out obviously with the residents at the Endo in U of T, and thank you very much for that. Now, I know they're teaching that process with Dr. Cherkas and yourself. Is that correct?
That is correct.
With the intraosseous. So tell me a little bit about your experience with intraosseous. I know you've been working with other systems previous to the Quicksleeper.
Well, as an endodontist, I probably get the hardest cases possible from my referring dentist. And a lot of times I'll get that proverbial hot tooth, that lower second molar that has irreversible pulpitis with or without apical periodontitis. That's just difficult to anesthetize because there's just so much inflammation around it that it just pushes those anesthetic molecules away when you're giving a traditional mandibular block or even a Gauge-Gates block. So we have to get right into the cancellous bone and bathe the tooth in local anesthetic. So by providing an intraosseous, or more aptly named a osteocentral anesthesia technique, where we can get right into the cancellous bone, right near the apex, we're able to provide the patient with painless endodontic treatment.
Fantastic, Gary. What do the patients feel? I mean, they're normally, walk away with a numb lip for a few hours. I mean, what's the experience with them? What's the feedback from your patients?
Well, that's the wonderful thing about Quicksleeper is that, number one, it's a painless anesthetic technique because there's a specific way to anesthetize the gingiva. And once you anesthetize the gingiva, because it rotates at such high speeds, the needle and the bevel, proprietary manufactured, gets right into the tissue and right into through the cortical bone, into the cancellous bone very painlessly. And then you can inject the anesthetic. And the great thing about it is, number one, you use less anesthetic. And number two, because you're using a osteocentral intraosseous technique, the patient doesn't walk away with a numb lip and a numb chin for 4 to 6 hours.
Oh, that's phenomenal. It's been a game changer. I mean, I've experienced this since 2015. I've been importing it from France. And basically what you're saying, it's not just endo, obviously, it's pediatric dentistry, any implants, any restorative dentistry, basically replacing the block. So you can do multiple teeth, multiple restorations. And I think for you, the fact that you can actually work immediately, put a clamp on and get to work.
Yes, you can get to work right away. I'm just going to shut off my mail because it's coming in. I don't want you guys to hear that dinging every time it comes in. Yeah, you can get to work right away. You can provide your patient with being comfortable. The experience that they have is favorable. They go back, they tell their friends. In my case, they tell the referring dentist, and the referring dentist wants to know how I painlessly anesthetize that number 4-7 or 3-7, and the patient left without a numb lip and numb chin.
Fantastic. Lastly, I know we're on a time clock here, but I appreciate, again, you being with us and taking this time. It's very valuable. What about your courses in the future? I mean, I know we've had this pandemic. How have you handled that?
Yeah, it's interesting. We have pivoted. So I've been providing my programs, my lectures and my hands-on programs remotely. So the lecture is an easy thing to do, right? We just log on to Zoom or what have you, Teams meeting, and we're able to provide a program quite nicely from being at your own from my office or from my own home. And of course, the doctors are in their office or their own home as well. But what's really cool and what's very unique about our remote live hands-on is we send the dentist a kit beforehand, usually a week beforehand, has everything they need to provide root canal education, 3D printed teeth, all the instruments, all the tools. Dentsply Sirona has been a proud sponsor of my program for several years now. And we log on and I lecture, I demo, and then the dentist follows along. The only thing that the dentist requires is a motor, which most dentists have. They have an electric motor. And coming into fall, we hope that this COVID crisis gets under control somewhat so we can get back to live in-person programs. So we have a number of programs planned. My premier program is coming up November 4th, 5th, and 6th with clinical dental training. So you can log on to www.clinicaldentaltraining.com and sign up for my 3-day live in-person course. I partnered up with Dr. Steve Buchanan. So 2 weeks before the program, you'll get a kit with 18 3D printed teeth, all the tools you need to provide access. You'll do that at least 1 week before. You'll send in photos so I can assess your accesses. And then when you come in for the live in-person program, we'll be together and we'll be able to critique them and show you what an ideal access looks like, what good looks like, and how you can modify that, because access is the cornerstone for endodontic success. We take you through anesthesia. Ron, you'll be there as well. We'll have a live hands-on program with Ron showing how to use the Quicksleeper Intraosseous Osteocentral Anesthesia. We'll provide you with the teachings of 2 nickel titanium systems, ProTaper Gold, Wave 1 Gold, irrigation protocols that provide predictable 3D disinfection, as well as obturation in 3 dimensions using the continuous wave of condensation. So I'm excited for that. And I'm excited to get back to meet everybody, because that's what I really love to do.
Absolutely. Gary, thank you so much. I really appreciate this and looking forward to meeting you in person again. Thanks again.
Yes. Thanks, Ron. All the best.
Take care.